One of my questions is, what do you think is the best way to reduce the debt over time? Because we're going to have to handle it, so what do you think is the best way to do it?
Yeah, and I talked about this a minute ago, and I'm glad you asked, because I think this is our generation's biggest problem, and we got to be honest about how to solve it. And so I went into the math before about what's actually causing it, and it's really hard to argue that it's anything else but our entitlement spending. So I'm going to divide spending into two categories, discretionary and mandatory. Discretionary spending is what we fight about every single year at the budget, on the budget committee and, well, in Congress. That funds our military, it funds every federal agency you can think of, it funds most of the things that you are aware of. Mandatory spending is actually 70% of our spending, on track to be more, because so discretionary as a percentage of our spending keeps decreasing, to include the military. As a percentage of GDP, it continues to decrease. Mandatory spending continues to increase. Why? Because healthcare costs keep rising and our population is aging. So I'm going to be honest with you guys, we got kind of screwed by the baby boomers. We did. They didn't have enough kids. They didn't have enough of you. All right, there's not enough of you paying into the system. They're aging and they're retiring, and we promised too much. Again, this is what happens when you have centralized control. This is what happens when you believe a group of experts can create the perfect program. They can't. They never do. Ever. The military is the closest thing we have to a perfect public program. And it's not perfect, but it is pretty awesome. Okay, so what do we do about that? Okay, raise the retirement age. Like, our contribution as young people is going to have to be that we're going to have to retire later. I firmly believe that. And it doesn't mean that we tell somebody who's 60 years old right now that they're going to retire later. We can't. They've been planning on that. What people don't realize is that over the last few decades, the retirement age has been continually increasing, I think by 2 months a year. It's an incremental thing, but it recently stopped because that was the end of the plan. It was the end of the legislation. So you got to up that. I think a more premium-based or premium support-based Medicare system would be better. Medicaid should be block granted. That would save money and give states the opportunity to actually design programs that work for them. And on Social Security also, I think we should consider means testing it. Means testing the benefits. So there's another line of thought out there that would say, let's increase the amount that's taxable. So right now it's maximum taxable to, I think, $120,000 around there. Here's why I disagree with that. I'd rather let people make it in life and then have all the money they need and then not give them benefits, as opposed to taxing you more now while you're trying to raise a family, create a business, make it in life. I don't want to tax you now. I want to just not give you too many benefits later. That's just, I think that's just a better way of looking at the policy.